Ladies and gentlemen, hello and welcome to TTVNEWS with some last events in Tay Ninh province, and now we come into details. Ladies and gentlemen, recently an online conference was held to make the preliminary wrapped-up report of the assignment in the first 6 months of the year and implement the tasks of the last 6 months of 2021 of the Home Affairs sector under the chairmanship of the Minister of Home Affairs, Tay Ninh. At the press point in the Ninh province, there were Mr. Nguyễn Hữu Ngân, Deputy Director of the Department of Home Affairs and officers of Home Affairs of district, town and city in the province.
Right from the beginning of the year, the Ministry of Home Affairs has focused on directing drastically with concentration. Initially, it overcame some inadequacy, proactively reviewed and reduced the certificates of foreign language, informatics, and other training certificates for civil servants. Minister of Home Affairs Tay Ninh asked the entire Home Affairs sector to focus on key tasks in the coming time, specifically continuing to build and perfect institutions to ensure consistency, synchronization, publicity, transparency associated with improving the effectiveness and efficiency in all fields of work of the Home Affairs sector. Building a professional and modern state administration serving the people with unified, smooth and effective management in all fields, promoting decentralization, authorization and enhancing coordination efficiency among agencies and organizations, fully carrying out the inspection and examination according to the plan, especially the organizational arrangement of the apparatus, the management of civil servants and public employees, tightening rules and administrative discipline. Responding to Workers' Month 2021, Tay Ninh Agriculture and Rural Development Trade Union had meaningful and practical activities implemented throughout the sector. In the Workers' Month 2021, it has completed 6 out of 6 works and jobs registered to respond to the Workers' Month, in which it visited and gave gifts to union members in difficult circumstances or suffering from occupational accidents, organized the inspection and supervision of the coordination in training implementation and the review of occupational safety and health risks, organized campaign to contribute funds to visit and give gifts to frontline forces who are on duty of epidemic prevention control, directed grassroots trade unions to develop union members, Law on Labor Trade Union. Ms. Trang Hồng Thảo, Chairwoman of Tay Ninh Agriculture and Rural Development Trade Union, said, in order to effectively implement Workers' Month in 2021, grassroots unions have coordinated with unit leaders and employers to effectively organize the implementation of project jobs according to the plan and register contents, creating an atmosphere of exciting emulation to contribute to the completion of assigned political tasks.
And in the first 6 months of 2021, businesses in the area have made great efforts to overcome difficulties, actively restore and maintain a stable production and business activities, and thereby it's contributed to help the province industrial production index achieve a good growth rate, increase the proportion of processing and manufacturing industry, and gradually reduce the proportion of mining.
Accordingly, the index of industrial production in the first 6 months of the year increased by 12.6% over the same period, in which the role of processing and manufacturing industry increased by nearly 13%, electricity production, transmission and distribution increased by over 12%, water supply, management and treatment of wastewater, and scrap recycling increased by 0.75%. The mining sector alone decreased by more than 10%. According to the assessment of the functional sector, the industrial production situation in the area in the first 6 months of this year reached 112.6%, much higher than the growth rate in the first 6 months of 2020. Currently, the province is still controlling the COVID-19 epidemic situation quite well, creating conditions for businesses to maintain production activities. A number of new businesses that have come into operation since the end of 2020 in industrial parks have contributed to increasing safely the province's industrial production. In order to supply the electricity for the border guard checkpoints of COVID-19 prevention control, recently Tay District People's Committee coordinated power agency to offer the electric generators for the checkpoints of COVID-19 prevention control in Ninh Điền, Thanh Long, and Biên Giới. The delegation visited and offered 15 electric generators for the checkpoints with the total value of 150 million Vietnam dong, sponsored by TayNin Power Company. In addition, TayNin Power Company also offered 50 million Vietnam dong to install the electric lights for two checkpoints in Biên Giới, Camille. This is meaningful and practical activities with the design of timely encouraging and sharing the difficulties with the frontline forces in the epidemic control and community health protection. Recently, Ms. Nguyễn Thị Hoàng Anh, Vice Chairwoman of TayNin City People's Committee, chaired a meeting of the Council for Product Evaluation and Classification of the City Level 1 Commune 1 Product Program, or OCOP. TayNin City has chosen 5 products or pre-units that ensure the conditions for evaluation and classification under the OCOP program. They are cantaloupe, Hoa Sop Special Honey, Oi, White Honey of Bảo An Honey Bee 1 Member Company Limited, Australian Mango R2 E2 of TayNin Youth Volunteer 1 Member Company Limited, and Baden Custard Apple product of Natini Company. Products are evaluated specifically and accurately according to the criteria of OCOP, including originated products with labels, food safety and hygiene, participation of community, uniqueness, product story, stable consumption market with potential for expansion, increase in economic value. The products are on specialties that are loved by many consumers. In particular, Nathanie's Baden Custard Apple is not only consumed in the domestic market, but also exported to the US, Russia, and Middle East countries.
And ladies and gentlemen, for the purpose of protecting and improving the people's health, since 2009, the government decided to make an annual July 1st as the Vietnam Health Insurance Day. And since then, health insurance policies have come into life more and more. The number of people participating in health insurance is constantly increasing. On towards the goal of universal health insurance, reaching the health insurance coverage at a rate of 95% of the population by 2025.
The highest purpose of health insurance is to contribute to the protection and improvement of people's health, to help people reduce the burden of medical examination and treatment costs when they are unfortunately ill, because the health insurance has paid most of the medical examination costs, testing and medicine for car hunters, as going for medical examination and treatment at medical facilities. Mr. Nguyễn Công Nghiệp, living in Ninh Sơn World City, said he has been participating in health insurance for 7 years now. As participating in health insurance, it brings a lot of benefits. For example, if he is ill and must go to the hospital, he only pays 20% of the cost of medical examination and treatment. He has many diseases and must make medical checkup at J Hospital for a year. If he doesn't have health insurance, every time examining there, it costs about 2.5 million Vietnam dong per time per month. But thanks to health insurance, he pays from only 400,000 to 500,000 Vietnam dong, depending on the month. Meanwhile, Ms. Lê Thị Lan, living in TayNin City, also said, I see that the health insurance is very convenient. We just enter the examination number and then get medicine. It is not difficult, but our benefits are also high. If there is any unfortunate problem, the health insurance fund will co-pay. Currently, with the openness of the policy, more and more people are participating in the health insurance system. The quality of medical services has improved markedly, meeting the satisfaction of the people. the Law on Health Insurance 2014 expands benefits for participants such as policy on online medical examination and treatment, increasing the benefits level for participants of health insurance from 5 consecutive years, expanding the payment coverage for many diseases. So the number of people participating in health insurance has increased gradually year by year. At the end of 2015, the health insurance coverage in Tay Ninh province only reached 68.02%. Then, by the end of June 2021, the whole province had 980,333 people participating in health insurance, reaching the coverage rate of 83.6% of the population. This is an impressive number for the province. To reach the goal of universal health insurance coverage, the nearest goal is that by the end of this year, the whole province will have at least 90% of the population participating in health insurance. The Social Insurance Agency wishes that people in Tay Ninh province are well aware and voluntarily participate in health insurance, both to protect themselves and for the benefit of the community. I hope that in the coming time, the rate of participation in health insurance in the province will be more and achieve the target set by the resolution of the Provincial Party Congress and the plan assigned by Vietnam Social Insurance to Tay Ninh Provincial Social Insurance. Implementing Official Letter number 1708 dated June 17, 2021 of Vietnam Social Insurance on guiding the communication on the occasions of Vietnam Health Insurance Day on July 1, 2021, with the theme Implementing Universal Health Insurance contribute to improving health and pushing back the COVID-19 epidemic. Tay Ninh Social Insurance has implemented many synchronous solutions in propaganda and mobilization of people to participate in health insurance, contributing to improving health, promoting health, and pushing back the COVID-19 pandemic. The government orientation in the current reform of health financing is to gradually shift from supporting medical examination and treatment facilities to directly supporting people through increasing the level of support and encouraging people to participate in health insurance, making health insurance into the main source of expenditure in the cost structure of medical care. In particular, it speeded the coverage of universal health insurance, resolutely handled cases of law violation, abuse and profiteering of the health insurance fund, strongly applied information technology in management of medical examination and treatment, and effectively management of health insurance funds.
And that's all for the news today. Thank you for joining us and see you next time.